Jillian Biros, as you all know, is our Southwest Senior Friendly Hospital consultant based at St. Joseph's Healthcare, London. Jillian has been working over the last 20 months on spreading senior-friendly hospital best practices across the Southwest Lynn. I'm going to invite Jillian to the podium, and she is going to set the context for our day together today.
Thank you all, and welcome once again to what promises to be a really wonderful day together. I've been looking forward to today. Actually, before I do this, by show of hands, can you raise your hand if you attended our Education Day last year? Okay. Well, welcome back. We're so happy that you joined us again this year. And then by show of hands, those that are new here today, your first time attending. Okay, a lot of you. So welcome, and we're so glad that you've decided to join us today. I wanted to start off our day here today with how we ended our day last year. Last year, I asked all participants to write on Post-it notes 2 words to describe how they were feeling at the end of our education day. And this was the feedback that we received. And the words that pop out were hopeful, motivated, inspired, excited, informed, enlightened. And we certainly hope that you leave feeling all of this today. Again, in bringing it back to last year, this day has been centered around you today. A lot of the planning, we really tried to focus on feedback from you. In me coming out to meet with your teams and with senior leaders at your organizations, and also taking into account the feedback we received at the end of the day last year. We asked your ideas about future networking opportunities, and your feedback was an event in this format, and here we are again for the second year. You asked about, or your feedback was quarterly telephone or OTN events, and we delivered on that by offering quarterly webcasts that we've had the support of the Toronto RGP in hosting, and we spotlighted promising practices there. And senior leader champion at each site named, and that's also been a success, which we'll talk a bit more about. Again, in your asks to us, sustainability, we asked you for ideas for implementing and sustaining senior-friendly hospitals within your organization. Your feedback was to make senior-friendly hospital strategy a standard of quality measures, accreditation, and strategic planning. And certainly when I've been getting out and meeting with senior leaders, there are quite a number of organizations that are looking at this and speaking about this at the strategic planning level. You might hear a little bit more later in the day about how the indicators work may influence other quality measures. You asked about focus being put into resources on senior-friendly hospital key priorities. And again, my deliverables within this project have really been to focus primarily on the LIN priorities of functional decline and delirium. So that's something we certainly took into account. Education for frontline staff to help promote the culture shift required. This has taken place. I've been meeting with teams, primarily home first implementation teams, and there's been wonderful staff engagement there. And a clear sustainability plan presented. That was feedback last year, and we're thrilled that we will have Rachel Stack facilitating us and guiding us through a workshop this afternoon on that. So, you have in front of you the agenda for today in your package. I'm just going to verbally go over what you can expect for the day. We really are in for a great day together. We've got Dr. Barbara Liu here with us. We're very fortunate to have her here, speaking to us about implementing and sustaining senior-friendly hospital practices and the importance of that. We'll hear from 3 hospitals in the Southwest that participated in the provincial indicators evaluation. Sue McCutcheon will be sharing with us a patient experience, and Rachel Stack will be facilitating an interactive workshop in the afternoon to get us thinking about sustaining our changes. So the objectives would be to sustain the senior-friendly hospital momentum in the Southwest. Southwest. We're doing such a great job, and we need to keep this momentum going. We're going to learn about implementing senior-friendly hospital care. We're going to work with our own hospital organizations. I know there's a tendency when we arrive at these events to sit with our colleagues from our own organization. And if you haven't done so, that's great this morning. It's nice to get out and talk with others. But this afternoon, you will notice when you come back to the tables, there will be tent cards on the tables. We are going to ask that you do sit with your hospital organization to look at creating a sustainability plan. Not to worry if you're here and you're looking around thinking there's no one else from my organization here with me. We've taken that into account. We will have a number of organizations at your table. There will still be an opportunity to share, and there will be a broader group meeting to look at from Southwest perspective, creating and talking about sustainability plan. We're here to share and learn from others, so certainly utilize those networking breaks and lunch, and get out and talk to others that maybe you haven't seen in a while, or introduce yourself to someone who looks new. And most importantly, we want you to have fun today. By a show of hands, can you raise your hand if this framework is something that up until today in your package you have not seen? Okay. So very few of you. I want you to take that framework out of your package and have a good look at it. If everyone could do that right now. I really want you to get comfortable with this framework. This framework is why we're here today, and it's at the heart of what we're here to talk about. We've included this beautiful colored copy for you. We want you to take this back to your organization and hang it somewhere prominent over your desk or by your door. I have extras I will put out at the back table at lunch or break. Please feel free to take some more back to share with colleagues or your organization. So every single one of us here today, we're here because we are invested in seniors and older adults. And you're already doing such wonderful things, but this 5-domain framework really does guide us in looking at, planning for, thinking about the services we're providing to an older adult population. So keep this framework handy with you today. As you're listening to the speakers and you're hearing from your colleagues during the networking breaks, and when you're working on your sustainability plan, think about how this work all ties back into this framework. Again, I know I'm preaching to the choir here, and I know that, again, you're here because you really care about the care we're providing to older adults. And we all know that there's work to be done locally and provincially in order to improve the care of older adults in our hospital system. And of course, these statistics reflect that. But again, by virtue of you being here, you're showing your commitment to improving the health and well-being of seniors in our hospitals. So I want to share with you some Southwest successes, and there have been many, so I'm thrilled to share with you. We really have come a long way. My deliverables for this 20-month project really have fallen within these domains here. So senior-friendly hospital care in hospitals. When the survey, the self-assessment survey was completed in 2011, so every single hospital providing care to adults filled out a survey. At the time, Southwest reported that 3 of 14 hospital organizations had a dedicated senior leader in place, dedicated to senior-friendly hospital care. I'm really thrilled to report that at this time, all Southwest organizations, all 14, have a dedicated senior-friendly hospital lead in place, and that's wonderful. Really, that ties in so nicely with the organizational domain of the organizational support domain of the framework, and without that, it's really difficult to work on the others. Education and capacity building. By the end of this month, all hospital organizations will have the resources needed to implement tools regarding best practices for delirium and functional decline. They'll have received education sessions regarding the Senior Friendly Hospital Toolkit, what it is, where the framework is, how to access all of that to continue with this great work you're doing. 3 hospitals in the Southwest participated in the provincial indicators evaluation, and we'll be hearing a bit more from them shortly. And there was a poster presented. We took a poster to the provincial RGP and OGA Education Day that highlighted the work that we've done in the Southwest, because we really have come a long way. As far as networking activities, there were 2 events. You're here today. This is the second. And the quarterly webcasts were held, which spotlighted promising practices that have been occurring here in the Southwest. Lynn. So I'm going to leave you this morning with this video, and I'll come back after. Hope you enjoyed that video. I heard some laughter. So the question this video asked was, can we get better behaviors by making something fun? And I think clearly here we saw that there was a change. So let's think about that today. As we talk with our tables and we think about the gaps to sustainability in working on our sustainability plans, we need to think creatively. Otherwise, we get stuck into our routines and our old habits. We need to start asking ourselves, how can we create the changes we know are for the better? So let's have some fun today, and let's think about that.